The caecum. This is a blind-ended pouch in the right iliac fossa. It's about 2.5 inches long and is completely covered with peritoneum. It doesn't have a mesentery, but it's largely mobile nevertheless. The appendix is attached to its posterior medial surface. On the inside, there is an opening of the ileocecal valve and the opening of the appendix. The opening of the ileocecal valve is above. The caecum is often distended with gas and sometimes can be felt from the abdominal wall. It is related anteriorly to coils of the small intestine, sometimes a part of the greater omentum and the anterior abdominal wall. Posteriorly, the caecum is related to the psoas and iliacus muscles, the femoral nerve, the lateral cutaneous nerve of the thigh, and the appendix, and medially to the appendix. It receives its blood supply from anterior and posterior cecal arteries, which arise from the ileocolic artery, which is a branch of the superior mesenteric artery. The veins correspond to the arteries and they drain into the superior mesenteric vein. The lymph drainage is to the mesenteric nodes and finally to the superior mesenteric nodes. The nerve supply, sympathetic and parasympathetics, derived from the superior mesenteric plexus. The appendix. This is a narrow muscular tube containing a large amount of lymphoid tissue. It's about 3 to 5 inches long. The base is attached to the posterior medial surface of the caecum and it's about 1 inch below the ileocecal junction. The appendix is completely covered by peritoneum and has a mesentery of its own called the mesoappendix, which contains appendicular vessels and nerves. The appendix lies in the right iliac fossa. Its base is situated 1/3 of the way up the line joining the right anterior superior iliac spine to the umbilicus, and this is called the McBurney's point, which is a point where you find tenderness in a patient with acute appendicitis. The blood supply of the appendix is from the appendicular artery, which arises from the posterior cecal artery, and the appendicular vein drains into the posterior cecal vein. The lymph vessels drain into nodes lying in the mesoappendix and eventually into the superior mesenteric nodes. The nerve supply is sympathetics and parasympathetics derived from the superior mesenteric plexus.